Hello, I'm Dr. Peter Everts from the United States, and I've been working in the field of regenerative medicine, orthobiologics for the last couple of years. I'm here at the Auto Region Conference in Rio de Janeiro, a great conference organized. And I was pulled away to give you my 2-minute take on platelet-rich plasma technology. That's not an easy task because there is so much to tell, and the field of the use of biologics is changing dramatically. But let me give it a try. Platelet-rich plasma is a small volume of plasma that has a high number of platelets in it. And ideally, it should be captured from a unit of whole blood from the patient and then processed by various machines, devices to get to that lower volume with that high number of platelets, where based on the technology and your goals, you also can add different cells in that cell mix. That could be white blood cells, particular white blood cells, or the full body of white blood cells. That's a very simple definition. And what can we do with it? There are many indications. The list of indications is growing almost on a monthly basis. And within all of these different specialties where PRP is being used, within these specialties we'll find different pathologies. I'll give you an example, as in musculoskeletal disorders. PRP can be used to treat joints, to treat ligaments, to treat tendons, to treat even spinal cases. But the secret really is to understand what is the ideal formulation, what is the ideal number of platelets, or known as the dose of platelets, that will make a clinical significant difference for patients. And we need to figure out for all of these different pathologies what that sweet spot of the injectate is going to be. So the potential for PRP in the short term and the long term is tremendous, as long as we keep on doing our research efforts, our training efforts in understanding more about the capabilities of PRP, because it's a living tissue. When we stick a needle in a vein to get the blood to make the PRP, we want to make sure that these cells stay alive and they keep on working, although we bring them outside of the bloodstream and inject them in the site where you would like to inject the PRP to treat a lesion or to have another effect, because the effects of PRP are way more than just delivering growth factors. When you look under a microscope on what a platelet looks like and all the different structures that are in a platelet, then you will realize that there are more structures in the platelets that can contribute to tissue repair or tissue regeneration. And it's up for all of us to understand exactly how the relationship between these constituents of platelets really are, and what the impact is if we concentrate the unit of blood to a smaller volume to inject them in musculoskeletal pathologies.